Welcome to Ask Barbie, where I, as your gynecology professor, answer your most burning questions about menopause and gynecology. Today's question is a very good one and also a very basic one. It comes up again and again. And once you understand the answer to the question, you'll understand why it comes up again and again. So the question is, how will I recognize the symptoms of perimenopause? In order to answer this question, we need to put it into context for how it will come up in your life. So there are two different scenarios. In scenario one, you are a woman who still has her uterus and starts going through perimenopause. In scenario two, you are a woman who does not still have her uterus and starts going through perimenopause. In either case, you need to know how to recognize the symptoms of perimenopause. In both cases, perimenopause is when your ovaries start decreasing their production of estradiol and progesterone. So, the progesterone decreases first, followed by estradiol. And ultimately, they both end up at zero. They are both gone by the time you reach post-menopause. The problem is that none of this happens suddenly. It all happens little by little, producing a few symptoms here and a few symptoms there. It takes a full 2 to 10 years for both hormones to completely disappear. And during this long period of time, there are non-linear changes in both of these hormones. So that's what makes it difficult for women to recognize the symptoms of perimenopause. Instead of these hormones steadily decreasing, they are actually both on a roller coaster for the full 2 to 10 years. They are erratic, they are chaotic, and the erratic and chaotic nature of these two decreasing hormones causes your entire body and your entire life to be chaotic too. Your symptoms of perimenopause are the result of these two hormones erratically, chaotically, and progressively disappearing. Estradiol and progesterone are the two hormones that produce your menstrual cycles. So at perimenopause, your menstrual cycles are a reflection of the decreasing quantities of both of these hormones. However, whether or not you will have any visible symptoms pertaining to your menstrual cycle will depend on whether or not you still have your uterus. And that's why I've created the two scenarios for our discussion. The symptoms of perimenopause fall into two categories. Those that manifest as changes in your menstrual cycle, and those that manifest as changes in other aspects of your life separate from your menstrual cycle. With regard to your menstrual cycles, most of the symptoms present themselves as a change in your periods. So for women with their uterus, perimenopause is a time when their periods become irregular, longer, shorter, lighter, heavier, or skipped. But in addition to those changes in your periods, there's a whole slew of other changes in various parts of your body that are due to roller coastering and disappearing estradiol and progesterone too. They include all the following: anxiety, heart palpitations, hot flashes, night sweats, insomnia, fatigue, forgetfulness, mood swings, irritability, depression, joint pain, joint stiffness, dry skin, hair loss, vaginal dryness, urinary incontinence, urinary tract infections, weight gain, decreased sex drive, headaches, PMS, drowsiness, cravings, breast tenderness, bloating, nausea, vomiting, leg cramps, yeast infections, loathing the things you used to love, and lust interest in spending time with others. All these symptoms make perimenopause very noisy indeed. It really gets your attention. The crazy thing about perimenopause is that you can have any combination of anything in either of those lists. Of course, whether or not you still have your uterus will determine whether or not you have any of the menstrual symptoms. If you still have your uterus, changes in your menstrual cycle may help you recognize perimenopause as perimenopause. If you don't have your uterus, you will have to rely on all the other symptoms that are not menstrual symptoms in order to recognize perimenopause as perimenopause. But my goodness, that list of symptoms that is unrelated to your menstrual cycles is a very long list of symptoms. And those symptoms span from your head to your toes, from your family life to your work life, and from your physical well-being to your emotional well-being. And let's not forget that perimenopause typically occurs somewhere in midlife. But don't focus on age for perimenopause. Age means nothing. Perimenopause can start at any age. So regardless of your age, you'll behave like a geriatric teenager and you'll feel like a geriatric train wreck. The only thing that is true for all women is that it is going to happen. You are going to become peri and then postmenopausal at some point in your life. So it's important to recognize it when it begins. The process of perimenopause can last for 2 to 10 years. And since it's such an erratic, chaotic roller coaster, it destroys your quality of life little by little. Some women wonder why we don't just use lab tests to determine whether or not you have reached perimenopause. And the reason we don't use laboratory testing is because the labs are totally unreliable. You see, I just told you that perimenopause is a time when your female sex hormones are erratic, chaotic, and on a roller coaster. So if you use any sex hormone labs of any kind at any time, you will not see the reality of your situation. Instead, you will get one snapshot in time that does not tell you the whole story. If you were to check all of your sex hormone labs every day during perimenopause, the pattern would shock you. You would see something that looks like a seesaw pattern lasting for years. The chaotic appearance would explain why your whole life is chaotic during this time. But there's no need to prove anything with lab testing when this is an inevitability for all women. You didn't have to prove puberty with labs. So why prove perimenopause with labs? Knowing the symptoms enables you to recognize perimenopause when it comes a knocking. Because the symptoms are wide-ranging and affect so many different aspects of your body and your life, it should be easy to recognize perimenopause. Unfortunately, medical professionals have no education whatsoever on menopause. And because of this such unfortunate circumstance, it is not uncommon for a woman experiencing perimenopausal symptoms to go to her doctor to determine their cause only to get shut down. All too often, the doctor tells her she's normal or she's crazy or that her labs are fine. None of these responses is appropriate. If you encounter any medical professional who dismisses or downplays your symptoms of perimenopause, keep shopping for one who will listen to you and help you manage your menopause your way. My goal is to arm you with the ability to recognize the symptoms of perimenopause so that you can smooth out the hormonal chaos and therefore smooth out your life. You just have to find a practitioner who will listen to you. So, recognizing perimenopause will boil down to one or more of the following things. 1, you'll have less predictable periods, but no other symptoms. 2, you'll have predictable periods, but symptoms of estradiol and progesterone chaos. Or 3, you'll have less predictable periods and symptoms of estradiol and progesterone chaos. Either way, your ability to recognize perimenopause as perimenopause requires you to know the big, long list of symptoms. It's a noisy transition with all sorts of warning signs. There's just so much more to it than hot flashes. And while women talk about hot flashes are not the most common or the most bothersome symptom of perimenopause. Instead, insomnia, joint pain, forgetfulness, weight gain, and vaginal symptoms are much more common and much more bothersome. You may think you're lucky if your perimenopause is silent and you don't have any symptoms. If so, you are greatly mistaken. Having symptoms alerts you to the fact that something is wrong. Having any or even all of the symptoms of perimenopause enables you to do something to manage your perimenopause. Managing your symptoms of perimenopause can result in prevention of the 3 diseases of estrogen deficiency, which are heart attack, osteoporosis, and Alzheimer's disease. If you have no symptoms, you don't get the wake-up call that enables you to manage your perimenopause in a way that prevents the fatal diseases. So you'll consider yourself lucky for not having symptoms, but you won't consider yourself lucky when you end up with heart attack, osteoporosis, and Alzheimer's. So while a silent perimenopause may seem like a benefit, it is not. A noisy perimenopause with lots of symptoms is always more life-saving in the long run. So wake up and recognize the symptoms of perimenopause as perimenopause when you have the symptoms of perimenopause.